Hi, this is Brian Ken. I'm going to share with you episode number 10 in the Surgical Instrument Review series. And in this series, my goal is to highlight different instruments for everyday cataract surgery that we use that might be different, perhaps better than the ones that we've always used. So throughout my training, we always used a Lieberman style wire speculum, and that's a good speculum for most cases. But I noticed as I've done more and more surgery in my practice, there are certain challenging situations that were made more difficult due to the Lieberman style speculum. So again, it's not due to challenges with density of the cataract or zonulopathy or shallow chambers. It has to do with orbital anatomy. So this is challenging access to the eye. And so with the Lieberman style speculum, there are a couple of scenarios where I had more difficulty. And so with the Epsilon E1-271 speculum, this is a narrow wire speculum, and it was designed for challenging orbital anatomy. Specifically, I believe Dr. John Davidson developed this speculum, and he developed it because he dealt with a lot of Asian eyes, which tend to have smaller openings. And so I'm going to show you, this is case number 1, and I'm going to share, again, just to show the different speculum. On the left side is the Lieberman style speculum, wire speculum. On the right side is the narrow wire speculum. So again, just to review, the Lieberman wire speculum is 15 millimeters wide. And the problem is there can be access trouble in deep set eyes, high hyperopes, and small eyes as well. And this is the other thing. This is a subtle point, but a very important point. When you apply maximum retraction, because it's so wide, it's a fixed retraction. And sometimes if your incision and the wire speculum are next to each other, it can make access more difficult to your paracentesis. In contrast, the Davidson wire speculum is only 10.5 millimeters wide. It's again a narrower speculum, again developed for Asian eyes. I will show you and demonstrate in these cases that there's improved access in deep set and small eyes. And again, maximum retraction can be adjusted because you can have more focused retraction and as well as an adjustable retraction. So again, because it's narrower, you can actually increase that palpebral fissure opening wider because it's a narrow area, but also you can adjust and move the wire speculum so that in case your incision, your paracentesis incision is being blocked by the speculum, you can move the speculum either nasally or temporally to get better access. So the video is going at high speed, mainly because we're not focusing on the steps of the surgery. I just want you to focus on the access. So you can see this patient has a small eye, and because it's a small eye, there's some pooling of fluid there. But you can see with this speculum, I'm not really having any trouble whatsoever. Even though there's fluid accumulating, I'm able to have good access. Why? Because of, again, that narrow focused retraction. Because it's a focused retraction, I'm able to actually get wider palpebral fissure opening. You saw I had to widen the incision. Why? Because this is a high-powered single-piece acrylic lens, again, in this small eye, high hyperope, and everything went quite well. And so that was my first case using that speculum. And here's case number 2. You can see this is a deep-set eye, a lot of fluid pooling. But look, I'm going to switch speculum. After I fill the eye with viscoelastic, this is a stable situation. I decide, okay, I'm going to take out the Lieberman, and I'm switching to this Davidson speculum. And you can see here, as I retract, look at the access. It's so much better than the Lieberman that I was using before. With the Lieberman, there was a lot more fluid. You can see the speculum was closer to the limbus. I had less retraction. Whereas with this one, because it's a more focused retraction, it's more towards the center, I'm able to widen it more. So it's just basic geometry. If the wire is wider, it's going to be more difficult to retract. Because the speculum is narrower, I'm able to achieve better retraction, but again, it's more focused over the center. So again, I'm showing all these cases in high speed, simply again, just to illustrate my access. I have better access for the surgery, for my paracentesis incision, for all the manipulation that I need to do for the surgery. This is again illustrating that I have better access with this Davidson speculum over the Lieberman speculum. And so this is case number 3. You can see I'm making my incisions and everything's going fine and dandy. Again, I'm at high speed here. Again, I'm not focused on the steps of the surgery. I'm trying to focus on the access to the eye. And so everything's going smoothly so far. And as I begin the phaco, you'll see where I'm going to run into some trouble. As I start to disassemble the lens, everything's going pretty well. The lens disassembly is going fine. However, you're going to see right here, the chopper is bumping up against the speculum here. And so, although I finished with the case, I just wanted to illustrate a point here. As I take the chopper out, I push BSS in, but I go ahead and move the speculum. You saw that? I kind of reduced the retraction, slid it over, and look, now I have no access issue. My paracentesis and my instruments are not butting up against the wire itself, and I'm able to finish the case. Again, the first case showed good focal retraction. I'm able to increase that interpalpebral zone, but with this case, I'm able to adjust my retraction so that the wire is not bumping up against the incision. So I showed the same thing here. You saw that. I was able to make a small adjustment. Again, everything again is in high speed. Again, just to illustrate the points of what I said earlier. You can see here my chopper is butting up against the incision. So I stop and I go ahead and move the speculum so I don't butt up against the speculum with the chopper. So again, a really nifty maneuver that I'm able to do. It's an adjustable speculum essentially. So if I had a Lieberman speculum, what would I have to do? I'd have to make a different incision. But look, pay attention. This is an RKI. I cannot move my incision because of the RK incisions. And so when I made my initial incision, because I have to work around the RK incisions, my speculum, if it was fixed, I'd be in trouble. I mean, I'd bump up into it, and it would be rather annoying to deal with that situation. But the nice thing about this is I'm able to reduce the retraction and adjust the speculum. I moved it nasally, and by doing it that way, I was able to adjust the speculum and basically move the speculum out of the way from my incision. And so this is the next case. Everything's proceeding just fine. I'm not having trouble whatsoever. And why? Because most of my maneuvers are through the main incision, and so everything is going fine. I'm disassembling the lens, but you see here now I'm bumping up against the nasal wire. Before it was the temporal wire, now it's the nasal wire. And so because I'm bumping into the nasal wire, what I'm going to do is reduce my retraction with the speculum. I'm maintaining infusion with the phaco tip. I move the speculum nasally, and then I retract once again. Again, I'm providing adjustable and focused retraction of the speculum, and I basically moved the speculum out of the way of my incision, of my paracentesis incision. So now I'm able to proceed with disassembly of the lens without bumping up into the speculum again, and finishing up the phaco part and the cortex removal, sweeping, filling the eye with viscoelastic, and the remainder of the case goes nice and smoothly. So again, adjustable speculum. Because it's narrow, I'm able to move the speculum and adjust it either nasally or temporally in order to get the wire away from my paracentesis incision. A really nifty maneuver that I've discovered by using this speculum. So again, this is the Davidson E1-271 narrow wire speculum. I feel like, you don't need this speculum for every case. The Lieberman wire speculum works just fine, or whatever speculum you're used to using. But just consider the fact that this speculum was specifically designed by a surgeon who deals with a lot of Asian eyes, small interpalpebral fissures. And you can use this speculum and have much better access, deep set eyes, high hyperopes. In those situations, I feel like the narrow wire speculum provides better overall retraction of the lids, because again, it's narrower. You're able to stretch it further apart, as you can see here. And also, if you notice your paracentesis incision is butting up against the speculum, the wire speculum itself, you can reduce the retraction and adjust the speculum either nasally or temporally because it's narrow. Again, with a Lieberman style speculum, because it's such a wide retraction, you can't move it side to side. It's not designed for that. But again, what I've discovered by using this, again, I'm not sure if Dr. Davidson developed it and designed it for this purpose, but one of the neat side effects of having a narrow wire speculum is you're able to adjust it, again, nasally or temporally, to move the wire out of the way of your incision. And you saw that RK case where the RK incisions dictated where I had to place my paracentesis incision. If the wire speculum was blocking that incision, it could be a challenge to do the surgery. You're trying to do the surgery and it's bumping up against it. And during delicate parts of the surgery, you don't want to be having your second instrument slipping and sliding along that wire speculum. You're able to adjust the location of the wire speculum, provide focused and adjustable retraction. And so I feel like this speculum, Epsilon E1-271, is really a nice addition if you wanted to have this speculum for challenging situations. I feel like it's really beneficial and has helped me throughout my cases of dealing with small eyes, high hyperopes, and deep set eyes. So I hope this was helpful to you, and I thank you for your attention.